All right, so now for the next 10 questions, 21 through 30. Question 21. An infant with a history of birth asphyxia presents with this above the kidney. What pathology is most likely? A. Wilms tumor. B. Adrenal hemorrhage. C. Neuroblastoma. Or D. Renal cell carcinoma. So here we have an image of a kidney-shaped type structure. It's above the kidney, so it's not the kidney. This is an infant. Now, an infant can have a neuroblastoma, but they typically have more echogenic structures and calcifications with it. The history of asphyxia makes you think adrenal hemorrhage is more likely. And that is the answer, adrenal hemorrhage, C. Renal cell carcinoma is the most common renal tumor or renal cancer in adults. And Wilms tumor is the most common in pediatrics. But this is within the adrenal gland, so that leaves you with two options, B or C. But the answer is B, adrenal hemorrhage. Number 22. What is present in the bowel of an infant with necrotizing enterocolitis? Number 22. What is present in the bowel of an infant with necrotizing enterocolitis? A. Infarct. B. Pneumatosis intestinalis. C. Abscess. Or D. Intussusception. So in this image, we don't see any target or bullseye type lesion, so intussusception is out. An abscess, you would have to check for inflammatory markers, increased white blood cells, fever, stuff like that. This patient already has a history of necrotizing enterocolitis, so the answer is B, pneumatosis intestinalis. You can see the gas bubbles within the gastric wall, all around there. Small bubbles and big bubbles with dirty shadowing from the air. So the answer is B, pneumatosis intestinalis. Number 23. What is present in the brain of this premature infant? A. Grade 1 bleed. B. Intraventricular hemorrhage. C. Periventricular leukomalacia. Or D. Hydrops. So here you can see this very smooth brain of this very premature infant. The lateral ventricles look pretty normal with choroid plexus, no real evidence of hemorrhage. But around the ventricles, you can see increased echogenicity. And then a few days later, you can see that these cystic areas start to form within the periventricular white matter. So this is a case of C, periventricular leukomalacia, or PVL. Number 24. What is the most common cause of renal failure? A. Glomerulosclerosis. B. Acute tubular necrosis. C. Glomerulonephritis. Or D. Renal artery stenosis. The answer is B. Acute tubular necrosis. Number 25. What structure is the red arrow pointing to? A. Ilium. B. Femur. C. Ischium. Or D. Femoral head. So this is your ilium here, acetabulum. This is the femoral head. The femur would be down here. So that arrow is pointing to the C, ischium. You see that right there. And images like these, where they're very labeled in detail, you can find them on my page, sonographictendencies.com, or even Instagram. I have a lot of those diagrams that I've made over the last couple of years. So number 26, a cyst located in the vaginal wall is A. Graafian follicle. B. Nabothian cyst. C. Gartner's duct cyst. Or D. Corpus luteum. So a Graafian follicle is a physiological or dominant follicle within the ovary. Nabothian cyst is a cyst that's typically located in the cervix. A corpus luteum is also located within the ovary. So that leaves us with C, a Gartner's duct cyst. Number 27, an infant presents with torticollis, which is the head tilted to one side. What is present in the right neck? So here you have sagittal images of the right and left sternocleidomastoid muscles. So what is present in the right neck? A. Lymph node. B. Thyroglossal duct cyst. C. fibromatosis coli, or D, lymphangioma? The answer is C, fibromatosis coli. Here you see the mass, the pseudomass or lesion within the sternocleidomastoid of the right within the right sternocleidomastoid. Number 28. Adolescent presents to the emergency department after a baseball injury. What is present? A, lymph node. B, muscle hematoma. C, hemangioma. Or D, lymphangioma. So, given the history of a baseball injury, your best bet is to go with B, muscular hematoma. Here you see the biceps muscle right here. This anechoic area represents a hematoma, likely from a muscle rupture or a tendon rupture. Number 28. What is the most likely diagnosis in this thyroid image? So here we have a large mid to hyperechoic lesion in the left thyroid lobe. Right here you got your carotid and jugular vein. So what is the most likely diagnosis? A, colloid cyst. B, thyroid adenoma. C, Hashimoto's thyroiditis. Or D, anaplastic carcinoma. So it's not a colloid cyst. A colloid cyst is usually anechoic with echogenic punctuate foci. Hashimoto's thyroiditis would have increased vascularity, which there's no color Doppler flow with this image, but this is a lesion. So the most likely answer is B, thyroid adenoma, as anaplastic carcinoma would be one of the rare thyroid cancers. So the answer is B, thyroid adenoma. Number 29. What symptoms does this patient most likely have? All right. So we have A, epigastric pain. B, left upper quadrant pain. C, headache. Or D, pain at McBurney's point. All right, so this is a picture of the right lower quadrant. You have a blind ending tubular structure with increased vascularity, intense hyperemia in that image. So that's obviously the appendix. This patient has appendicitis. So most likely they would have pain at McBurney's point, which is in the right lower quadrant. Answer is D, pain at McBurney's point. And number 30. The last rib is typically located at A, T11, B, T12, C, L1, or D, L2. The answer is B, T12. So this is important when you're counting to find out for the level of the cotus medullaris on infant spine ultrasounds. You can count from the sacrum up, or you can count from the last rib down. All right, well, stay tuned for the next 10 questions.